We are welcome to today's health outreach. I pray that if Jesus tarries, we would have many more of these, and it will be profitable for you and I in the name of Jesus Christ. Health, they say, is wealth. People say healthy eating is healthy living. It's not all about eating. Some people believe that it's only the sick people that go to the hospital in this part of the world. But in the other part of the world, they believe that you go to the hospital for health check. And a lot of us do not do that on this side of the, in this side of the world. In remembrance of our late mother in Israel, Mommy Juliana and Nike Sadela, the church has come up with this program for us to have a health talk about how to take care of our eyes, and also to have a eyes check to see if vision is okay. Sincerely, a lot of people are walking on the streets and they have bad vision, but they don't know. There's what we call glaucoma. Glaucoma is something that, happens suddenly. You see someone that can see today, and by tomorrow, the person just goes blind immediately. And you'll be wondering, the eyes was not swollen, no redness, no itching, nothing. So it's a great privilege for you to be here today to come and have your eyes checked. Without wasting much of our time, I want to introduce our speaker this morning. He's going to talk to us about how to take care of our eyes, and also he will be on ground to check our eyes and also for consultation. He's someone that I've listened to, and I know that he has a wealth of experience, to dish out measures in taking care of our eyes this morning. He's an optometrist, and what does optometrists do? They are frontline eye care giver, and they examine the eyes, and also they diagnose and they treat. He is a well-experienced doctor, and he works with Ancilla Catholic Hospital, one of the largest organizations in the world, and he has a lot of experience this morning. Without wasting time, I will introduce Dr. Emmanuel Utomi. With Jesus Joy, GSC Ikeja Joy, I wanted to welcome Dr. Emmanuel Utomi. He will be teaching us this morning, and I want us to listen very well. And I pray that God will help him to deliver to us. Thank you very much, sir. God bless you.
Thank you so much. Good morning, everyone. Like she said, my name is Dr. Emmanuel Utomi, and it's my pleasure to be here this morning to give you a talk about the eyes. Straight away, I will start from where she stopped. She began to talk about glaucoma and other eye issues. Glaucoma is so special that we have a whole week in a year dedicated to it. We call it World Glaucoma Week because of the importance of glaucoma. It has a whole week. And during that week, we carry out sensitization exercise. We go about enlightening members of the public about their eyes and about glaucoma. If you open your Bible to Matthew chapter 6, the Lord Jesus began by saying that the eye is the lamp of the body, and that if your eyes are good, your whole body will be flooded with light. For you to appreciate that statement, I'll crave your indulgence for just a minute. Just close your eyes. Yeah, go ahead. Close your eyes. What do you see? Who knows? When you closed your eyes, what did you see? Yeah? Another answer? Good. He got it. You saw something. Darkness. It's not as if you didn't see anything. You saw something. Everything was just black and dark. And that's the vision that somebody who has advanced glaucoma or somebody who is blind, that's the vision the person has. So Dr. Sadela brought me here today to talk to you about how to take care of this precious gift. And now one of the simplest ways to take care of your eyes is what we are going to be doing today, having your eyes checked. So she knows that the eyes are one part of the body that a lot of people take for granted. You know, except you have a manifest problem with your eyes. For example, maybe you have difficulty seeing things that are far or difficulty reading. That is when you will remember to go to the eye clinic. If you can read, if you can see, most times you don't bother about the eye. The eye is not like the other parts of the body that maybe somebody that has malaria, immediately starts having symptoms and he knows that there is a problem. Glaucoma, for one, does not give any symptom. Glaucoma will not make your eyes red. Glaucoma will not make your eyes to itch. Nothing. There is no pain. But there is a problem. There is a problem. Now, the only way you can know about glaucoma is when you go for an eye check. And during that eye check, your eye pressure will be measured. You know, because the eye pressure gives us an indication that there is a problem. And then, part of what I'm going to be doing today, I will look inside your eye with my equipment. I will look at the back of the eye, because that is where the classical signs of glaucoma are. So for those of you that are here today, one of the benefits you are going to enjoy is a free eye screening. I'll look at the back of your eye and I will tell you if there is need for you to come for more specialized testing. And if everything is okay, I'm also going to tell you. Then apart from that, we are going to be assessing your visual acuity. Visual acuity simply means the level or the extent whereby the eyes can see. With the VA chart has already been mounted. With the VA chart, we'll be able to estimate your level of vision, and we'll also be able to know if you have a refractive error. Now, what is a refractive error? A refractive error simply means that there is a problem with your eye that needs to be corrected. And many times, the treatment for refraction or for refractive error is glasses. So when we take your VA, we'll be able to tell if you are short-sighted. For short-sighted people, they have difficulty seeing things that are far. When they look at distant objects, it is blurry. Then we also have those who are long-sighted or hyperopia. These people, they have difficulty with seeing things that are near them, and then sometimes they have problems with things that are far also. But basically, long-sighted people can see things that are far clearly, but have difficulty with near work. Then we also have those who have what we call astigmatism. And then we have the refractive error that is called presbyopia. Presbyopia is the type that throughout your life you've never used glasses. You've been seeing well and doing your work well. Then suddenly you notice that you can no longer read your Bible. You can no longer read tiny prints. For you to be able to read tiny prints, you take it far. That's what we call presbyopia. Presbyopia occurs as a result of aging. Then there is another problem that we call cataracts. Cataract is an age-related disease of the eye. As people get older, changes occur in the body. For some people, their eye starts turning gray. Their hair, starts turning white. So also changes are taking place in your eye as you age. One of those changes is cataracts. Also, cataracts can be caused by other things. For example, your systemic condition. We have cataracts that can be caused by diabetes and other systemic conditions. So, an eye check is vital because normally we tell people that the eye is the window of the body. Why do we say the eye is the window of the body? You know the function of a window. From this window, you can see what's happening outside. A window, in addition to allowing ventilation, also gives you vision. It allows you to see what's happening at the other side. Now, the eye is the only organ in the body from which we can see right into the nerves. There is no other part of the body that you have that level of access. It's just the eye. So, when I use my ophthalmoscope and look into your eye, what I'm doing, I'm looking at your optic nerves. I'm looking at your retina. And in the retina, we have veins and arteries. So when I see these veins and arteries, the appearance of it will give me an indication of your total level of health. For somebody who has diabetes, there's a way those arteries and nerves appear. For somebody who is hypertensive, we can see it from the eye. So imagine going for an eye test. You just went for an irregular eye check, and from there, you get to find out that you are diabetic. And you know the complications that can come from diabetes. If you don't get to know on time, it can cause very serious changes to your body. You know? We have what we call diabetic coma, where the person will just suddenly slip into coma. And then for diabetic people, they have problem with wound healing. Just a simple injury that others will have, and the wound will heal after a few days. For a diabetic person, it's not so. It will lead to ulcer. And then you might have amputation. So these chronic diseases are best tackled if you get to know on time. You know, so that's why what Dr. Sadela is doing today cannot be overemphasized. Because how many of you have ever gone for an eye test? If you've ever gone for an eye test, just take a look around. Just 1, 2, 3, 4, 5. Not much. Because people don't really consider their eyes. They don't really consider their eyes until there is a problem. And you know the funny thing about glaucoma? Glaucoma is a disease that causes blindness. And glaucoma does not have any treatment. The vision that you have lost to glaucoma cannot be replaced. So the only effective treatment against glaucoma is what we call early detection. You get to know on time before it starts causing damages. So if we get to find out on time, we will start treatment. What is the treatment? We'll just place you on some eye drops that will help you to be controlling the eye pressure so that the pressure does not go up and damage the optic nerves. So that's the treatment goal. And this eye drop is for life. It's for life. So it's a very important thing. And then there are kids here also. Some people believe that children should not use glasses, that it's too early. Why should a child be using glasses? And others even actively discourage their children, from using glasses. But it's not the best. Most times it's the teachers in school that even find out that your child has a problem. Because most parents, when they see their child, a scenario is this: you guys are watching TV at home, and the child suddenly stands up, walks to the TV, and sits right in front. So most times when parents come to the clinic, they will even tell you that this child goes too close to the TV. That's why he has this problem with his eyes. And I've been telling him to go back, not to go too close. But the thing you must know is that the child is going that close because he cannot see from where you people are. He has to go very close to be able to see the TV. So when you have that, just know that the child has a problem with the eyes. It should be an indication to you. I had a patient once that came to the clinic. He brought his son. He never knew his son had a problem. How did the man discover? He said he was driving one day and the son was sitting by his side. And as he was driving, he read something that was on a billboard. As he was driving, he saw a billboard and he just said it and he told his son, look at what they wrote there. And the boy looked and said, Daddy, I cannot see anything there. There's nothing written there. And the man was amazed because the prints were large. A billboard. And he was like, so you mean you can't see that? The child said, no. And the man really got alarmed because he could see it. But the son was not able. And when he brought the son to the hospital, we discovered that the son was highly short-sighted. And the problem is, when children grow up, their systems are still developing. So if a child has a refractive error at an early age, and that error is not discovered, what we'll experience is what we call vision loss due to deprivation. Because the eyes of this child was not given the room to develop, a condition we call amblyopia will set in. Meaning, it will get to a point, the brain will accept that this is the best way this child can see. And it will just be like that. Even when the child gets older and you try to do an eye test to give glasses, it will no longer work. Because there's what we call a full development at that stage. So for children, it's very important that they should go for an eye check. It's so important that most schools these days, when you go for admission for your children, either primary or secondary, they insist on an eye test for everybody. It's one of the admission requirements now in Lagos State. So, because they want to discover if the child has an error or not. Does the child need glasses or not? Then, for those who are professionals, because of our changing lifestyle, these days we do more of computer work. A lot of things are not done on the system. So you see people spending more than 2 hours in front of a computer screen. So if you work in an organization or your job involves you using a computer, you should actually use eye protection. You should wear glasses that have anti-reflex coating. Most of these are our electronic devices, our phones, our computers. They have what we call blue light. They emit blue light. The phones we use these days are not really like the phones you used before, your Java phones. The phones you use these days are screen-based. They are touch screen. You do everything on the screen. And the screen has a self-illumination. Meaning, even if the room is dark, the screen emits light and you are able to see what you are doing. You can read, browse, and all that. Now, the phone is able to do that because of the blue light technology that is there. Now, this blue light is very harmful to the eyes. Prolonged exposure of your eyes to blue light can cause what we call macular degeneration. It's a very, very serious complication of the eye. So if you use electronic devices, you are always on your phone, on your laptop, computer, please, you also need to get eye protection. So you see, it's not only people who are short-sighted or who have a refractive error that need glasses. Even if you feel that you see very well, you also need glasses if you walk in front of a computer for more than 2 hours. And then, if your job involves you dealing with hazardous chemicals, or you are a welder, you need to wear protective goggles when handling such chemicals or when welding. Because the truth of the matter is that no matter the extent we have gone in eye care, there are still some things we cannot do. If your cornea, the cornea in your eye is that black part, and that cornea is even the most important part externally. It is like the camera. It's a transparent structure. It is where light passes through. If anything happens to the cornea, that eye is gone. Because if the cornea, just imagine using a mirror that is cracked. If you have a mirror and it's cracked, or you are driving, your side mirror is cracked, are you able to see anything? No, it's diffracted. You don't see a perfect, clean image. So that cornea, you have to guard it jealously. And that is why we also advise that you don't do self-treatment. Don't. Never, ever do self-treatment. Never, ever go to a chemist or a pharmacy to buy an eye drop just because somebody told you to. Because the condition you are dealing with might be totally different. It might not be conjunctivitis. A lot of people think that any red eye is a conjunctivitis. You know what conjunctivitis is? What they call Apollo. Your eye turns red, it's teary. So you just go and buy any eye drop. Don't do that. I once saw a patient that had a red eye. She went to a chemist, and she said she explained to the person who was there, and the person gave her an eye drop. Now the funny thing is this: the eye drop that was prescribed was totally unrelated to the condition the lady was suffering from. I guess the seller just saw that as an eye drop and felt, you can just give that. And when she finally came to the clinic, we already had complications with that eye. So if you have a red eye, even in ophthalmology, in eye care, a red eye is what we call ocular emergency. Yes. In medical school, they will tell you a red eye is an emergency. So if you wake up with a red eye, immediately find yourself in an eye hospital. Let them check it and tell you that, oh, it is okay, right? Instead of going to a chemist to buy anything. A red eye is an ocular emergency. Don't do self-treatment. Don't prescribe that, oh, when I went to the hospital, this is what they gave me. I think you should use it. No. Even people who use glasses, the glasses are not the same. You cannot see that lady wearing glasses and you say, oh, let me borrow your glasses and use. No, it does not work like that. Glasses are not even the same. Some people are using plus lenses. Some people are using minus lenses. Some people are using a combination of plus and minus. So how would you know whether you are plus or you are minus or you are plus? So the glasses, you are looking at it, you think it's just ordinary glasses. No. Glasses are not even the same. Because you have couples who share glasses. The husband will say, I use my wife's glasses, and the wife. You can't do that. You have to check your own and get your own. Each glasses is made with you in mind. We specify it for your error. And then when you are, like I said, when you're doing, because this makes me, I remember a case I saw once. This lady said she was doing house cleaning, removing cobwebs and the rest. And then some particles fell into her eyes as she was going about it. And she just brushed it off and thought it was nothing. She came to the clinic after 3 days because the eyes were now red and puffy. But the thing is, by the time she came to the clinic, I discovered that the cornea was perforated and had developed an ulcer. And like I said earlier, the cornea is supposed to be transparent. If anything happens to your cornea, there's really nothing we can do. We can recommend a cornea transplant, but as of today, I'm yet to see a successful keratoplasty. I'm yet to see. So it's best you protect this one that God gave you. So when you are doing your house cleaning that will involve you lifting your eyes to look at something up, please wear goggles, because debris might fall and enter your eye and puncture the cornea. Just last week, on Saturday, a man brought his son to the clinic. The man said he was nailing something, and he asked the son to hold the stuff. As he was nailing the thing, the nail just pulled off and right into the son's eye and punctured the boy's eye. The boy is a young boy, I think about 5 or 6. Punctured his eye. We'll do all what we can do, but that eye, the prognosis is very bad. So when you are doing these things, you really have to be careful, especially people who handle batteries. I've seen a lot of battery accidents. Acid from batteries pouring into the eye, splashing into the eye, and all that. So if you work with hazardous chemicals, get protection for your eye. Don't expose the eye. And even if you don't use glasses, if you are going to go under the sun, make sure you wear dark glasses that have UV protection. UV light is not good for the eyes. Prolonged exposure of the eye to UV rays can cause cataracts over time. So taking care of your eyes is a compendium of activities. You have to do many things. But in summary, it's just 1, don't do self-treatment. 2, if you have any issue with your eye, go to an eye hospital. No matter how simple it is, let us check it and guarantee you that, yes, the thing is okay. Go and do this. Because we cannot replace the eye. The eye is one of the most delicate organs in the body. You can treat other parts of the body, and after a week, they will tell you, oh, it was wrong diagnosis, change the drugs. But we can't do so for the eyes. We have to be sure. We have to be specific. Because if anything happens to your eye, coming back might not be easy. So we will need to do a screening, so I wouldn't want to take too much time for the talk. But if you have any question, you can ask. And maybe from your questions, I would talk about anything I might have left out. Thank you very much. So if you have any question, okay.
Thank you very much. Thank you very much, Dr. Emmanuel. Really, okay. So I had a friend who recently just communicated to us that she has glaucoma. So and then, so now when we're talking about the fact that the suddenness of glaucoma affecting the eyes, the question I have is, she mentioned that while we were in school, maybe 5 years ago, that she used glasses, right? But then she typically would have teary eyes and stuff, and so she just thought maybe she would normally see her rush to the front of the class when we were having classes and all of those things. Over time, she saw that she needed letterings to be bolder. And now, so why I'm asking this is that looking at that specific case, we could see a timeline, a trend of degeneration in terms of our eyesight. How does that now, that seemed like a sharp contrast with what you said as to the fact that glaucoma could be sudden. Does that mean maybe she had like maybe two different eye defects, or could it be that it was glaucoma that degenerated over time? That's my question. Thank you.
Okay. Myra, thank you very, very much. The question he asks is a very intelligent question, because from his question, he has brought up a new dimension to glaucoma. Now, what happened to your friend is this. Glaucoma, like you said, you rightly said, is a degenerative condition. And it is progressive in nature. You know what it means to be progressive? The thing will start and over time it's getting worse. Now, for your friend, what happened is this. At the point of diagnosis, the glaucoma was already advanced. The glaucoma in her case might have started from her early childhood. When did she start treatment with the eye drops and everything? So you see that you come to the clinic now and we diagnose you of glaucoma and we start you on the eye drop does not mean that all is well. Most times, it might mean that we are only delaying blindness. So, the point of diagnosis is very important. At the point of knowing this girl has glaucoma, how far had the glaucoma already gone? If it was an advanced stage, we can only just delay the unfortunate ending by giving her some more years. So that's the nature of glaucoma. It is a progressive disease. So over time it progresses. Many conditions in the eye are that way. We have another condition that we call retinopathy. We have this very popular, there's this very popular one that is a progressive disease. It is genetic. It starts from 20, and it happens in the retina. I'm trying to recall the name. It's not a very common ailment, but it happens. Most of these eye conditions that are genetic in nature, most times there's nothing you can do. When we see it in the clinic, we just make the diagnosis and counsel the patient that, okay, if you need to travel, just use your eyes, see things, because this thing is going to get worse. We just prepare you. And in such conditions, it's only God, that can heal those eyes. But the main thing is, let's get to know on time. There's a question.
Thank you so much, Doctor. Speaking about sitting behind screens for longer hours, and there's a part you've mentioned which is using reflective or glasses and all of that. Now, does using a dark theme, does it help?
A dark what?
A dark theme. So
okay.
there's this
computer screen guard.
Exactly. No, not even a computer screen guard. So against, typically all the screen would always come in white.
Yes.
But then you switch it such that it's then in black and every other thing is in white. Does that help?
No, it doesn't. What you just did is to reduce the background light. You just made it dark so that the fonts will come up. This blue light, it's invisible ray. You don't see it. It comes out from the screen. It emits. It's not about the screen, like, I say this screen is too bright. Can you darken it a bit? No. When you darken the screen, it helps me see it better. But it does not stop the ray that is coming from the screen. The ray will still be coming. The only thing that will stop it is if I put an additional screen cover over it. So most companies have screen guards that they put. It's called blue protection. It prevents the blue light. And you can check it on your phone. Most phones these days, they have blue light regulator. If you go to your settings, try to click on the blue light regulator. You will see that everything will change on your screen. It will no longer be bright and glossy. So it's this blue light that gives you that sharp contrast, that HD feeling. It's the blue light that does that. So you must get a screen guard or use glasses with ARO coating.
Thank you, sir. Please, I want to ask a question. Is in 3-in-1.
Okay. Yes.
I want to ask about cataract. One, is it hereditary in nature?
Okay.
One. Two, is it aside from doing operation, is there any other means for the solution, as in for correcting cataract? And also, the third question is, can cataract in the same eyes, can you have cataract in at least 2 or 3 times in the same eyes?
Thank you. Now, talking about cataract, number one, is it genetic? Yes. So when you go for an eye test, the first question we ask, when we ask for your family histories, do you have an history of cataracts? Is there any history of cataracts in your family? So it's genetic in nature. But majority of the cataracts we see in the clinic are age-related. They are age-related. If you live long enough, you might develop some form of cataract. Like I said, cataract is an age-related change. But not everybody will need a surgery. In your eye, there is a lens. There is a lens inside the eye. It is that lens that develops the cataract. Now, the extent of the level of the opacity in the lens is what determines if you will need a surgery or not. And now let me just debunk some claims. I see a lot of claims made by charlatans and quacks on the internet, especially on Facebook. They market certain eye drops and medication, and they tell you that this thing can dissolve cataract, it can do this, it can do that. It's all a lie. Most times, if you see, those eye drops are very expensive. When you buy it, it will not work. It does not work. The only way to deal with cataract is to remove the natural lens in your eye. We will remove that lens that has the cataract and we will put an artificial lens. That artificial lens will be transparent and you will start seeing. So to answer your question, when you remove the natural lens, you are not going to get cataract again. So it's not possible to have cataract in the same eye after you have removed the original lens. What you have after your cataract extraction, most times, is what we call post-capsular opacification, PCO. What happens there is that that artificial lens that was put in your eye has developed some opacity on its own, and then we can do a laser to just remove those. So it's not possible to have cataract in the same eye after you have done a cataract operation. The third question is, there are other conditions that can cause cataract. Anything that injures your eye. For some people, they had a blow to the eye, and that blow to the eye affected the lens, and the lens had a cataract. That kind of cataract is called traumatic because it was from an external insult to the eye. You know? Then you can also have cataracts that are related to your systemic condition. Diabetes can affect the lens and induce cataract. You know, so those types are the ones we call systemic cataracts. But basically, majority of cataracts that you have is the age-related type. There are some questions here, so let me quickly read and answer. My eyes itches most times, but there is no discharge. What can I do? I'm here, so I will see you. But normally what you can do is to go to the clinic. See, the wise thing to do is anything that happens to your eye, let it be an opportunity for you to check your eye. Because it might just be God trying to tell you that there's something serious. You know, you might happen that you just go to the clinic to complain of itching and they discover glaucoma. And because of that thing you did, you now saved your eye. Whereas you would have woken up one day to blindness. It happens a lot of time. I've seen patients who said, I saw a man once, he said he was in the shower. He went into the shower seeing. He put soap and everything. When he washed his face, he was seeing darkness. So he felt somebody sent him a spiritual arrow. When he came, that was what he actually said. He said it's a spiritual attack, that it was inside the bathroom, that it must be the soap. But when I looked at the eyes, I saw that the pressure was really high, and then the glaucoma was really advanced. So I told him, no, glaucoma is what just happened. And because of that suddenness, most times we say glaucoma is the silent thief of sight. It just comes and in a moment, it goes. My upper and lower eyelid twitches, sometimes simultaneously. What can I do? Most times when you have eyelid twitching like that, it might be connected to a refractive error or something else. When you go for an eye test, we'll look at it and know what exactly is making your eyelid to twitch. My eyes brings out discharge, whitish sometimes, creamy when I wake up. Is that normal? When you have whitish discharge most times, it shows that there is an infection in the eye. And that's just how the eye has reacted. The eye produces antibodies to fight the infection, and they emit as discharge. It means there is an infection, so you need to treat the infection in the eye. When I look at light, I see lines, even though I use glasses. What can I do? It depends on how frequent you see that. Is it every time you look at light? Anytime you look at any light, you see lines? We will need to do more investigation. What kind of food can I eat to take care of my eyes? Beautiful question. Now, nutrition and the eyes is simple. There are food nutrients that are highly needed in the eyes. Most times, the eye needs what we call antioxidants. Antioxidants are very good for good eye health. If you look at your retina, one of the components of the retina is beta-carotene. Beta-carotene helps in vision, and you can find beta-carotene in carrots. Other nutrients, you have many vitamins and minerals that you need for good eye health. And most of these things can be found in fruits. You know, fruits like orange is a good source of vitamin C. Vitamin C, ascorbic acid, is an antioxidant. Antioxidants, they can prevent cataract formation. They help in macular health and all that. And today we are going to be giving the first 50 people I'm going to attend to will go home with antioxidants, courtesy of the organizers. You know, you go home for coming early, so you are going to get that. And when you use it, you can, if you like your experience with it, you can buy it. It's very good for every person that is above 40 or even 30 and above to use antioxidants. If you use antioxidants, these things they call cataracts, most of these eye diseases that are age-related, you will not have a problem. You can be 80 and still be seeing very well and not need a cataract surgery. So it's not a must that everybody must have cataract that leads to surgery. No. Can I wash my eyes with soap? No, we don't wash the eyes with soap. You can't say your eyes are dirty and you want to wash. Even in the hospital, we don't wash. We don't wash the eyes. What we'll do is this. You can flush the eyes. You flush the eyes when maybe something like a chemical spills into your eye. The first thing you do, we say for the first 20 minutes, just flush. Flushing means you go under a running tap and allow water to just flush the eyes and wash off the chemicals before you go to a clinic. It's something you can do as a first aid. So if you are near somebody who complains that he had a chemical burn is when chemical splashes into your eye. The first thing you should just take the person to is to a running tap. Let water flush the eyes for 20 minutes. And then, by then, all traces of the chemicals would have been washed off and you would have helped to protect that eye. Because the longer the chemical stays in the eye, the more the damage. But you don't use soap and sponge and scrub. No, we don't do that. Okay, somebody was asking about makeup, but it's like this large dot. Okay, does makeup affect the eyes? If it enters the eye, yes, it does. Like, I've seen a case where a lady was trying to attach this artificial latch, and the glue entered the eye. It was a serious condition. It was a very serious condition. There was another case that happened that she was preparing for her wedding. And on the night to the wedding, she wanted to do this thing. So she went to a quack. I think the professionals don't use glue. The glue they use, industrial glue. I think they have a special thing they use. But this quack person used both normal glue and put it. And the thing entered the eye and closed her eyes. Just imagine glue clamping the lids. She was in terrible pains. When she went to the hospital, after all said and done, the thing had already affected the eye. Her cornea was scarred. She had what we call corneal scarring, and it was not good. So the man that was supposed to marry her said when he came, she had two eyes. There is a lady that had two eyes that he came for. It's not for that he didn't send her. That sorry that he cannot go on. So that was what happened in that case. So when you are using makeup, you have to be very careful. Don't allow the thing to enter your eye. And if for any reason anything enters your eye, do what I said. Flush your eye with water for 20 minutes and then go to an eye clinic. You need immediate intervention to save that eye. So those are all the questions I have here. Thank you very much. If you still have any question, okay, I think this will be the last before we go to the screening.
Okay. You've answered like few of my questions, but I actually wrote them down.
Okay.
But among the questions, do we need to be on a constant eye vitamins? Like you said, beta carotene, that is found in carrots. But is there like medications that one can use constantly? And secondly, those glasses, do they have expiry dates?
Okay.
And
That's a good question.
okay, you said what's it called? Cataract and glaucoma are genetic. How about being short-sighted and long-sighted? Are they genetic too?
Okay. So let me start from number one. The vitamins, the beta carotene. You can, like I said, we are going to give you antioxidants. Now, these antioxidants are chemical supplements, formulations that they have all the micronutrients that you need for your eye. They have the beta carotenes, retinol, and the rest of them. So when you take a capsule of an eye antioxidant, it already has all these nutrients for your eye. So we normally prescribe it one a day. But most times they are not cheap. So people have difficulty continuing. But if you can afford it, one a day will be very good. If you can take one antioxidant tablet a day, I assure you, if you start now that you are young, you will not have problem with cataracts. You will not. And all those age-related changes. Anything that will happen to your eye might be an accident. maybe you hit your eyes or something, but for something coming from your system, no. Because that's what, and now we give our patients, especially in the organization I work, we make sure that anybody that is 40 and above, we goes home with antioxidants because we know the importance of antioxidants. So the antioxidant already has all that. Then the second one, you said glasses, whether they expire. Glasses really don't expire. What happens is this. It is you that changes, not the glasses. A -2 lens today, if you, for example, you are using -2 or +2, glasses are inanimate. They are not living beings. They don't grow old. So a -2 lens today will still be a -2 lens in 10 years. But what happens is that your error might have changed. Maybe you are no longer a -2. You are now a -3. The error in your eye has increased. So you find out that those glasses are no longer strong. You can no longer see with them as clearly as you used to. So the error is what changes. But what we'll say is that, oh, your glasses are now weak. But the true term is that the glasses don't get weak. It is the person that changes. So that's what happens there. Then, what was the third one you said? Yes, they are. They can be genetic. A short-sighted parent might give birth to a short-sighted son, and vice versa. So it could be genetic, but it could also be environmental. Like I said, we have vision anomalies that are due to deprivation. Imagine a child that was born and was never exposed to sunlight. The son, all through his early ages, was kept in a dark room, maybe in prison with the mother. That child will develop problems. There are some people that they didn't have problem with their eyes, but they had problem with Abacha, and they were taken to prison. And during Abacha's time, his kind of prison is not normal prison. They will take them underground in a dark room, in a dark cell. And the person will spend 5 years. By the time the person comes, he has developed all kinds of eye issues. It happened to Gani Fayemi, even though he was already using glasses. But by the time he went and came out, it just exploded. Most of those human rights activists then, a lot of them developed some serious eye problems by being deprived of light. And it's a form of torture, a form of punishment to keep somebody in a dark room for an extended period. It damages the eyes. By the time the person comes out, the person will have eye issues. It's certain, and it has happened. So sometimes you have errors that are due to deprivation. So these are cases that they were not born with the disease. It wasn't genetic, but it was environmental in nature because of the kind of environment the person was brought up in. So I hope... Okay, you have one more? Okay, let me take us first.
Thank you very much. So we've talked about, food intakes, diets that, can help with the eye. But I'm just curious to know, are there also food intakes, some meals that we should avoid,
Thank you very much. For foods that you should avoid, it has to be systemic, not necessarily because of your eye. For example, somebody who already has diabetes, they will tell you that, because we know that diabetes affects the eyes. So when you see your doctor and he says, oh, you have diabetes, avoid this food, don't eat this and that. You are doing it because of the diabetes. And inversely, it will also protect your eye. It's not as if not eating gari or not eating rice would do anything to your eye. No. It is just because of the systemic disease you have. So when you are told to avoid some foods, it is not directly because of the eye. It is because of maybe the condition they've diagnosed. And that disease has an effect on the eye. So when you manage that disease, you are also protecting your eye. So that's the relationship between diet and the eye. Then Dr. Sadela asked practices to avoid. Don't put urine in your eye. Urine will not cure conjunctivitis. In fact, urine might infect your eye. Imagine somebody who already has some STIs or something, and the person is now putting urine that already has all those bacteria and everything back into the eye. You will just damage your cornea, then have corneal ulcer. I've seen a case like that, a lady that put urine in her eye, and the next day she came with corneal ulcer. So don't put urine in your eye. Don't put breast milk in the eyes of your babies. Don't. Breast milk is not a cure for eye disease. Don't put any chemical in your eye. Don't allow anybody put anything. The eye is too precious for you to do native treatment. The eye is too precious for you to experiment. Some people get some leaves and squeeze the water and put inside their eye. If you have an infection, how much is gentamicin? We are going to give people gentamicin today for minor eye infections. Please, so don't put, if you put urine in your eye and it worked for you, it wasn't the urine. That thing was meant to go. The thing was self-limiting. There are some illnesses in the eye that will cause self-limiting eye disease. That means this is an eye infection that will go whether you do anything or not. So if somebody comes to you and says, don't mind what that doctor was saying, he's just trying to sell eye drop. I use urine and my own cleared. No. If you have we have what we call viral conjunctivitis. If you have viral conjunctivitis is self-limiting. It will go after 2 or 3 days. So it is not that urine that you put in the eye that cleared it. It was meant to go. So urine does not treat anything in the eye. Neither does breast milk or any chemical of such. So those are some of the harmful practices when you talk about the eye that I've seen that people do a lot. They do it. Some people put sugar solution. You know, some people will put salt in water and put it in the eye. It is better to just pray Psalm 21 or 23 than to put.
Thank you very much. Just one question I have. Okay, so typically, like you have, they tell you exercises up with different organs of the body. You have, for people that have dementia or Alzheimer's, they tell them you do brain exercises and all those kind of things for different organs of the body. Are there exercises for the eyes too?
Thank you. You have eye exercises that you can do. We have what we call the 20-20-20 stuff. If you are working in front of a computer, after every 20 minutes, look at something that is 20 feet. You know? Look at it for 20 seconds to a minute. You know, so if maybe I've been working in an office, I've been working on a document for 20 minutes. 20 minutes. I just pause. I remove my glasses if I was wearing my glasses, and I look straight at something far. 20 feet is far. So just look at something far and just be looking at the thing. Just stay there for the next minute or so. That's a visual exercise, because by simply doing that, you are relaxing the eye muscles. What brings vision to you is a combination of the eye muscles. There are ciliary muscles in the eye that bring about this adjustment between far and near. So by the time you adjust the eye, your vision from near to far, you are exercising those muscles and you are keeping them fit. So just the same way you go to the gym, you lift weights to work on your muscles, the same way you can do on the eye, but you don't put weights on the eye. You just do this, you alternate. That's what we call visual training. So you have some eye exercise, and the simplest you can do is this one I just said. It won't cost you anything. Just sit, raise your head, look at something far, and just stay like that, because you have been looking at something near for a long time. Now look at something far for at least a minute or two, and then you go back to your work.
Okay. Good morning, sir.
Yeah, good morning.
So my question is, it happened directly to me. So I was in junior secondary school and someone did something behind me. And during the class time, so the teacher looked at me. So the expression on my face looked at as if it was I was the one. So she brought me out. The next thing she did was to slap my face. And immediately she slapped me, I wasn't feeling very good. I started seeing stars, let me use that word. So, so after she slapped again on the other side of her face, and I said, I couldn't say I wasn't the one because I used to have a very low self-esteem. So to talk is always an issue for me. So the next thing she did was to send me out of the class. She kept me under the sun for about 2 hours for what I did nothing about. And after that, getting back to the class, I couldn't see well for about 6 hours. Everything I see will look as if someone is beating me. And the eyes were very heavy. So I got back home, I told my parents. My parents said, okay, they had to see the teacher. They went back the next day. They spoke to the teacher that this child has not been able to see some things since yesterday, or since the occurrence yesterday. So the teacher said, no, she didn't do anything. She denied. So we went to the doctor, and the doctor said I was having malaria or typhoid. So the question is now, I don't know if it happens to a child in primary school, and probably they couldn't say it out to an adult, or what could have been the cause, because after a while I still could not see well. So what would have been the cause of that? That is my question.
Yeah, thank you. Wait. How is your vision now? Do you see well?
I've been managing, actually. I've been managing.
Don't worry, I will check your eyes. So
okay.
But the thing is this. Please, let me talk to the parents. And if there's any teacher here, please, I've seen a lot of eye issues that came from trying to discipline a child. Children can be stubborn. We know that. We were all kids. And at some point in our lives, we exhibited some level of truancy. You know? I know the Bible says, spare the rod and spoil the child, the rod of correction and all that. But the rod of correction doesn't always have to be a cane. It can be your mouth. You can correct with your words. You don't always have to go physical. Because I've seen cases where a parent was trying to discipline a child, and the cane hit the eyes. And the child lost that eye. That guy was lucky that the slap was not that severe. I've seen people who were slapped and they lost. There was a man that came to the clinic. He said a soldier slapped him. He lost that eye. Straight up, he lost the eye. He lost the eye. And the soldier, he can't see the soldier to hold responsible. And he's spending money. How did it happen? In traffic. You know? And he can't see the soldier. The soldier just slapped him. At the point of slap, he thought it was an ordinary slap. But it was not an ordinary slap. Because by the time he came, we saw that it has damaged the eye. The retina was bloody and everything. So, she asked about activities to avoid. Please, avoid trauma to the eye at all. By the time you are arguing with somebody, just know that if this guy blow me, because I am not prepared. You know, when you are arguing, you are not prepared. Sometimes you are just going to talk to the guy. You don't know, you are not ready for a fight, so you might not be ready. And the next thing you see a punch, and it lands on your eye. And that eye is gone. What were you people arguing for? 20 naira change. You said you came down, the person did not give you change. And you started arguing. The next thing, it was a blow. And that eye is gone. You can't even see the conductor now, the bus. You can't see it. You are spending money in Ancilia. You have given us 200,000 for surgery. And it's not as if your eye is coming back. You know? So we really have to apply wisdom when it comes to daily living. There are many things that you can avoid by simply walking away. A lot of things you avoid by just simply walking away. Walk away from arguments, especially if it doesn't make sense. Imagine arguing over 10 naira change or 50. You know, just walk away. And then in traffic, we see a lot of things in traffic because of road rage. Traffic in Lagos is mad. Somebody wants to enter your front, you say no, you drag. Why? You won't carry the road by the time you pass. And then, because you were preventing him from not entering your front, the two of you bash each other. And then you come down, and you don't go to where you are going. You are settling arguments. And depends on its level of exposure, it can degenerate. It can go south very fast. And before you know, you have eye injury. Because we've seen that when people fight, one of the parts of the body that gets injured most time is the eye. Because if the person wants to slap you or blow you, it's your face. They are not blowing you on your chest. Nobody will blow you on your hand. They are targeting your face. And if by chance the thing gets to your eye, and then we are seeing a lot of one chance injuries. People enter cars and the first thing they rub pepper and stuff in their eyes. We've seen cases like that. So we really have to exhibit a lot of wisdom these days. Like I said, there are a lot of things you can avoid by just walking away. And if you are a teacher, don't correct with a cane. Don't. Never ever do that. There are punishments you can give a child that will still convey that feeling of he has done something wrong to him, rather than always resorting to the cane. No, don't go and cause permanent injury because you were trying to help a child. No, don't cause permanent injury. You could go to prison. In Lagos now, they don't tolerate anything you do to children. The Lagos State government will not support you because you are a teacher in their school and you said you were trying to correct an erring student. You now blinded his eye. They will sue you, you will pay for damages, and you will still go to prison. So please, let's try and avoid all those activities that can damage the eye. Thank you very much.
I think we can do better than that. Let's jam our hands together for Dr. Emmanuel Utomi. He has really done justice to the lecture this morning. Do you agree with me? Have we learned a lot? Let's jam our hands together once again. Thank you so much, sir. Really appreciate you. Thank you for the opportunity to glean from your wealth of experience and knowledge. I want to charge us this morning. We have learned a lot. It's not for learning's sake. I want us to, make use of that which you have learned today. And I pray God will help us. And by His grace, till we go to meet Jesus at old age, our eyes will be intact in the name of Jesus Christ. Amen. So without wasting much of our time this morning, we are going to start the eye check. But before we do so, there are some of us here that have not registered. We are not going to attend to you if you have not registered. So if you have not registered, I want you to go back. There's someone behind us there. Register your name, your phone number, and what have you. So we're going to start right now. This is the process flow. We'll start from checking our BPs and our weights. Then we'll have our visual acuity check, the next stand. Then the third stand is to see Dr. Utomi himself. He's going to check your eyes and he will have consultation with you. Then you go to see the pharmacist. From the pharmacist, you go for counseling. I think we have five stand, right? 1, 2, 3, 4, 5. 5. Okay. So let's start. People from this, have you registered? All right. So you can move there, please.